Hello everyone, my name is Jasmine and today I'm going to be educating and informing others on the STD syphilis. I will be speaking about syphilis, the detrimental effects it has on the body, and ways to prevent it. We know that there are many STDs that are existing. However, syphilis is one of the many that has many stages, specifically 4 stages, and long-term effects on the human body that people are not aware of. In today's society, many adolescents and adults are being educated on STDs prior to becoming sexually active. However, not many know what an STI is, and syphilis is considered an STI. STIs are sexually transmitted infections, which is a sexually transmitted disease that starts off as an infection according to the Planned Parenthood. Today I will be briefly speaking about syphilis and the effects it has on the body. I believe my speech will help someone who is planning on to become sexually active, help someone with taking precautions who are already becoming sexually active. A few points that I am going to talk about is the definition of syphilis and how it's treated and prevented. Also the stages. So what is syphilis? Well, according to the Cleveland Clinic, syphilis is a life-threatening sexually transmitted infection that is spread through sexual contact via vaginal, anal, or oral sex with an infected individual. It can be detrimental to your health and even cause death, affecting organs in your body. Okay, now that we know what syphilis is, let's talk about the disease process and how it affects the body. According to the Planned Parenthood, the first stage, which is the primary stage, this stage occurs 2 to 12 weeks after exposure of syphilis. A cancer or a sore is usually noticed at this time. This is alerting the body that it has been infected with syphilis. The cancer is usually, it comes in one sore, which is a round, firm, and painless sore. It can hide deep inside genital areas. It can be visibly seen on the genital areas. Also, rarely seen around the mouth and lip. It will pop up as one sore at a time as well. These are usually mistaken for a normal outbreak of ingrown hair, pimples, because they're not painless. So they can hide. Also, as I said earlier, they typically go away 3 to 6 weeks, even if you're not treated. But this takes you into the second stage because you are carrying that STD still. The second stage is the secondary stage. This stage, there are rashes on the hands and soles of the feet. Also, rashes in other areas of the body. They are not itchy rashes at all, but a person may present with flu-like symptoms, slight fever, headache, muscle aches, sore throat, swollen glands, fatigue. They may have sores around the mouth area or other genital areas, even weight loss and hair loss. These symptoms can last up to 2 to 6 weeks and go back and forward, like come and go within up to 2 years. However, if you are not treated still at this point, you go into the third stage or the latent stage. And according to the the Cleveland Clinic, if stage 1 and stage 2 are not treated, you're going to go into the third stage, which you don't see any more outwardly signs and symptoms. They are now infecting the inside of your body, your organs, your heart, your bones, and nerves. This can last up to 10 to 20 years if not treated, according to the Planned Parenthood. According to the Cleveland Clinic, the fourth stage is the late stage, tertiary or late syphilis is what it's called. The symptoms usually don't progress to this stage because people usually get it taken care of. By then they know something is going on. However, if not, if the symptoms are too mild to notice during the third stage, they go into this last stage, which is life-threatening. This becomes detrimental. This can cause death. The brain is damaged. Dementia develops. The mental health problems, heart disease, heart attacks, movement disorders, muscle problems, nerve damage, causing seizures, vision problems, even causing blindness. It's just treacherous to the human body. Okay, now that we know the disease process, let's speak about some interesting facts of prevention and treatment. before I go into that, syphilis can be congenital. If you are pregnant and expecting to have a baby, it is important to get screened, which is a part of the screening nowadays, to get tested for syphilis, because if an infected mother is pregnant, she can pass it on to her baby, and the baby can be it could be detrimental to the baby. It could be fatal to the baby as well. Okay, so another thing, most people who are infected with syphilis are either men or gay or bisexual men. Also, according to the Cleveland Clinic, 80,000 people are diagnosed each year with syphilis. Most people who are already HIV positive or have been positive for chlamydia or gonorrhea are at a higher risk of catching syphilis, or having unprotected sex with multiple people can also contract syphilis at a higher rate. So here are some ways to prevent contracting syphilis. 1. Abstain from sex. 2. Get more factual information on STDs and what they are. 3. Get tested. Know your status. There are blood tests that can test. It's not nothing invasive that can tell you your status. Also, if you become positive, get cleared first with your negative results before returning to having sex, and be cleared by the doctor first so that you don't spread this deadly disease. Okay, now you know about syphilis, what it is, the treatments and prevention, how it affects the body, the disease process. I hope that it helps someone. An interesting read is the Tuskegee Syphilis Study. It happens between the 1930s and 1970s in Tuskegee, Alabama. Read up on it. It's a great book, very educational. I hope that I was able to help someone on today. And as always, if you have any questions or comments, please leave any reviews at the bottom of my video. And as again, know your status. Practice safe sex. Thanks. Bye.